When we heard Covered California was beginning to roll this out, the plan at the time was to do one in Fresno and one in Sacramento, and that would cover the valley. And in true Stockton fashion, we said, oh, hell no. We want one right here to have a little range for the middle part of the valley, too. As you all know, we have huge disparities that exist in our valley, and it's really important that we get the information that we need to be able to provide as many people with coverage as possible. Covered California, California has taken the lead on this, and I know one thing for sure, is we need to show in California that it can work. And we can make it work by community members like you coming out to get the information to enroll as many people as we possibly can. Now, some people will say healthcare reform didn't go far enough. Some people say healthcare reform went too far. So hopefully we're somewhere in the middle and we'll make this work. And just real briefly, a little personal anecdote. On June 14th, we were voting on the budget, and my partner texted me and said she's got to take her sister to the hospital. She felt really bad. And we both said at the same time, she doesn't have health care insurance. Oh my God. But because she didn't have health care insurance, her only option was to go into the emergency room. So within a matter of 3 days, through the emergency room system in Sacramento, she was diagnosed with a very aggressive end-stage terminal cancer. So we've been dealing with that this last month and a half, and I can tell you that my experience, our experience, is not unique. There are over 6 million people in this state who don't have health care coverage. And when a family gets a diagnosis like we got, you shouldn't have to worry about how are we going to pay for it. You shouldn't have to worry about what are we going to sell so we can qualify for Medi-Cal. In this great state, in this great country, everybody should have access to quality health care. And we do that best by making sure people are insured and that we all pay into a pool so that there's something for all of us. So it is so important, the work that you're going to be doing, to go out and sign people up, because you know that we got to go deep within the layers to get those people, those invincible 20-something-year-olds, 30-something-year-olds. My sister-in-law, 49, and a lifetime hairdresser who didn't have enough money to be able to pay for her own health care insurance. This program will allow everybody the opportunity to be able to pay in as they can. So I thank you in advance for all the work you're going to do. I thank Covered California for coming out and doing this today, and just welcome, and let's make this work, California. Thank you.